Hey, community, we're back, and I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And together we are.
BNB, the community
Yep,
NPs.
yep, yep. So, listen, today we're going to have to talk to y'all about having high cholesterol because so many people have it,
Yes.
and it's preventable. But if you get it, it can cause a lot of problems. So basically, what it is, it's like a waxy substance that's found in the blood. Everybody needs it for good health, but if you have too much, then it becomes problematic. So people with high cholesterol have a higher risk of developing heart attack, stroke, and other health problems. And then the higher cholesterol, the higher your risk for developing those things are.
Yes. So let's talk about some facts about high cholesterol. So Hispanic males lead the country, Americans, with having high cholesterol. So
Mm,
Hispanic males, they're leading the country. 93 million US people ages 20 and over have a cholesterol higher than 200.
that's sad.
Yeah. So at 90 million, 93 million, that's a lot. 93 million people.
That is.
Especially for because it's something that can be prevented.
Mhm,
So when you think about 93 million people with increased cholesterol, so it tells you something's going on with our diets.
mhm.
Nearly 29 million adults, Americans have a total cholesterol higher than 240. So that's high also.
When I
All
think
this could be,
a million
huh?
people, even just like 1 million, seems like a
Yes.
whole lot.
Yes. But look at the kids. 7% of US children and adolescents ages 6 to 19 have a high total cholesterol.
And I believe that to be true because I see a lot of kids that are overweight, and
Yes.
I check their, cholesterol and other labs, and it comes back high. And it's sad because like these kids are just sitting in front of electronics all day long, watching TV all day long. Kids hardly go outside anymore. So unless you have a athletic kid that is playing like some sports outside of school, they're not really getting any exercise. I don't even know. I was gonna say I don't even know what they're doing in PE these days.
Probably nothing. I can remember as a kid growing up, like I woke up in the morning to get dressed to go outside. I wanted to put on some clothes to go outside.
Yeah,
Wanted to be outside the house. I wanted to be outside. So I don't know.
things are not the same.
What
Not.
are we doing with these kids these days,
But
BB?
you know what else? Even like if you didn't want to go outside, somebody was gonna tell you get up and go outside.
Yes,
Like,
yes. Go
land.
outside and play. Go
Yeah,
outside and play.
I remember this one auntie of mine. It would be like, y'all need to go outside and stay outside, and I'm put some water outside. Y'all can. And we'd get cups. We'd all have our individual cups. We can come in the house until a certain time. I'd be like, man, this is crazy, but it's standard. So we out here playing.
So, Brandon, what are some of the symptoms of high cholesterol?
So usually there are no symptoms. It's typically found because we suspect that they may have high cholesterol, maybe because of something they said, or because they're overweight, or they have those other comorbidities. And we do it and we check their blood work, and that's how it's found. So
Okay.
but I guess if there is no suspicion, there's still recommended times that it should be checked anyways. So for ages, I mean, with kids, it starts from ages 9 to 11. So somewhere between 9 and 11, they should have their cholesterol checked at least once. And then again, if it's normal, between the ages of 17 and 21.
Okay.
What
Okay.
about what about adults? What's their?
So for men, um, 35 at age 35 and above, unless they have risk factors. So if they have risk factors, you may want to check it earlier.
Yeah.
For women, it's usually at age 40 and
Hmm.
above. And of course, for both, if you have risk factors, you're going to go ahead and just check it early.
Yeah.
You're not going to just wait till those ages. And I find myself a lot of times, especially with my obese patients,
Hmm.
I go when I do the annual labs, I go ahead and check cholesterol.
Me too.
I just go ahead and check it, and you'll be surprised the numbers that you get. You know,
Yeah. That's very true, and it's some of the numbers are alarming. You're like, okay,
I know.
let's make
We need to
some
start
change
you on some medicine today.
right today.
Yes, 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 yes.
But so
Yes.
there's different types of cholesterol. So when we check your cholesterol, we're gonna check your total. Then there's the LDL, which is the bad cholesterol. You get that from like bad fats, fried foods, oily foods, red meats. And then there's the good cholesterol. You you get that from what? What do you say?
No, saying cheese.
Oh yeah.
Yeah,
Yep.
yeah,
All
cheese.
that dairy products. But the good cholesterol, you get that from like good fats, like avocado, nuts,
Salmon.
salmon.
Yes, I like. Yeah, the
Yeah.
olive fish, even sardines, like sardines, salmon, trout. Not no catfish. Not
Ah, not the fried catfish.
tilapia.
Mm. Let them know,
Yeah.
B. Let them know. And then
Yes.
triglycerides, we also check that, which is not actually a cholesterol number, but it's a different type of fat, but it's found in the bloodstream as well, and it's not healthy.
No, it's not at all. Not at all.
So what should
All
your
right.
numbers be?
So we want you guys to know your numbers, okay? So we're gonna play a number game. We want you to know your numbers. So your total cholesterol should be below 200.
Mm-hmm.
Your LDL, which is your bad cholesterol, should be below 130. And we want it much lower, especially if you're at risk for heart attacks or strokes.
Like if you have high blood pressure, diabetes.
Yes, diabetes. Yes, I want it lower than 130,
Yes,
much lower than 130.
much, yeah.
So your HDL, which is your good cholesterol, should be above 60. And I tell my patients all the time who have low HDLs, a lot of those people are sedentary. They don't get up, they don't move. Get up, get moving, get the heart rate, moving, and that may help your HDL come up. Your non-HDL cholesterol should be below 160 or lower, and your triglycerides should be below 150.
So sometimes the triglycerides they fluctuate, like they can
Yes.
fluctuate from day to day. So if a patient comes in, their triglycerides are very high, then we may be like, okay, come back fasting. Let's just make sure. But
I do that
if
a
they
lot.
are really high, typically it's because of alcohol consumption or like a really fatty meal the night before.
Yeah,
Or
you had, Burger King, you had, your McDonald's the night before.
um,
Yeah.
pork.
Yes.
Pork is
Yes.
just horrible.
Brandon, not all pork is horrible, okay?
What pork is good for you?
You can get you a lean
Okay.
piece of pork. You
Yeah.
can get you a, look at me, you get you a lean piece of pork.
No, it's full of sodium and fat. You tried it though.
So what are some of the risk factors?
Cigarette smoking, number one. Having high
Yeah.
blood pressure, um, a poor diet that's high in fat, and
Mm.
then as your age goes up, your risk goes up, and then having diabetes. Also, if you have a parent, sister, or brother who had heart disease at a young age, then that puts you at higher risk.
Yes, 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 yes. So just avoiding those things you can avoid having high cholesterol.
Yep. So, what are some of the treatment options?
All right. So some of the treatment options, of course, there is medications. Okay.
Hmm.
Decreasing your alcohol intake. If you smoke, avoid smoking. As we said, you want to be more active, physical activity, doing cardio for at least 30 minutes most days of the week. Some
Yes.
type of cardio. I know we talked about brisk walking, treadmill, elliptical, stairmaster. You say you like what, kickboxing, Brandy?
I
Or you
do
said
like kickboxing, although I haven't done it really since I moved here. But I like the stairmaster and but kickboxing is an alternative, good cardio.
okay. You want to lose weight. If you're overweight, you want to lose weight. And one of the things that we all can do is like our diet. Avoid eating red meat.
Hmm.
If you do it in moderation. So when I like red meat, so I'm gonna be honest. So when I do eat red meat, I try to get the leanest piece that I can get of red meat. Instead of getting a ribeye steak, I may get like a filet mignon. A smaller, less fatty steak. Okay. Of trying to lower the amount of butter that you intake, fried foods, cheese. Cheese was a big one. I didn't realize that cheese affected my cholesterol so much. But avoiding those dairy products and other foods that are, that's high in like saturated fat. So a lot of our fast foods, anything quick and easy to go, a
Hmm.
lot of those foods have high cholesterol in those foods. So you do want to avoid. So that's why it's good to prepare your own meals, basically.
Yeah.
Prepare your own meals. You can treat yourself every now and then, like once a month. You may want to go out, but prepare your own meals. That's your best bet.
You know what I think has helped a lot of people lower their cholesterol, even like when they start
What?
preparing their own meals, is investing in an air fryer. Like,
I don't have an air fryer.
no, oh my
No,
God.
it's crazy because we just purchased one for my mother-in-law. My mother-in-law loves to cook, and she can cook. Like she can cook. And I saw one, I was like, oh, my husband's like, we should get that. I was like, yeah, we should get that for mother. And we just sent her one. I think she got it yesterday.
Oh, that's good. You should get one because for one, it'll save you so much time. But like things that you would fry at home, you put it in the air
Okay.
fryer and it comes out just as crispy. And it
Like
doesn't.
chicken. So if I want fried chicken, it'll come out crispy.
Yep. And it doesn't have, and you don't. I'm dead serious. And then
I'm about to say, well, how you know? Because you fried chicken?
yeah, not for
No,
me.
she said she vegan. She said she vegan. So that's what I'm trying to say.
I live in a house of carnivores, so I gotta feed them. But yeah, so I'm telling you, anything that you would typically fry in oil, you can air fry with an air fryer.
Okay, okay. Well, I'm gonna let my mother-in-law test hers out first, and I'm sure she's gonna tell me how everything goes, and
Mhm.
then I'll decide if I need an air fryer brand new.
You do. I'm telling you.
I bake a lot of my foods. Like I bake a lot. I
Okay.
do a lot of baking. Yeah,
Well, the air
I
fryer,
try not
you can get stuff very quick. You can get stuff done.
to. Community, did you hear those words come out of my mouth? Mm,
but anyways, yeah. So just make little changes.
yeah. I mean that's don't want to make drastic changes because you want to be consistent with it. So
Hmm.
you want it to be a lifestyle change, not just a change just for a week, but something that's lifestyle. It's gonna be life changing.
Yeah,
So
something sustainable, something that you can manage. So, those fad diets don't really work because you can't sustain it for a long period of time.
that's what we have to do. Yeah.
Yeah.
All right. So as we always say, this information is just knowledge. It's just knowledge that we want to share with you guys. We want you to share with your family members and friends. It's a spark of conversation, so you can start talking about cholesterol. So when you go to your doctor, you can ask, "What's my LDL? What is my bad cholesterol? What do I need to do to get my good cholesterol up?"
Yeah.
So those just questions that you know that you can ask your doctor. So that does not mean that you don't go to see your primary care providers. Please still go and keep your appointments, at least your yearly appointment to see your primary care
Please.
providers. Right.
But yeah, and then ask your when you go to your mama house, be like, "Mama, did you cook this in oil? Because I'm trying to lower my cholesterol, ma'am, and I'm out here trying to live my best life. So I need to know."
Yes, 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 yes. I'm gonna ask my mama that when I go to the house. I'm gonna say, Brandon told me to
No.
ask you, did you cook this? I'm gonna ask my mama that. I'm gonna tell her what Brandon told me to ask.
Every
Mama, Brandon.
mm-mm. You can't ask Miss Cheryl that. Nope.
Yes, I will. Yes, I
Not
will.
in
Somebody,
blame me. Not
I'm
in.
gonna, I'm gonna say Brandon. Brandon told me to ask you. Yeah.
Mm-mm.
But yeah, but like we just want you guys to be healthy, um, and just so you can live your best life,
Yeah.
like so you can enjoy life. So we both are working on that. Brandon has me, watching what I eat, and I'm exercising more,
Hmm.
at least 3 days, 3 to 4 days a week. I try my best to go and work out.
And she's
'Cause
not eating meat every day. So
I'm not. I'm not. I want to practice what I preach. Like if I'm telling people not to do these things, I need to do it myself also. So
I think you're doing an amazing job. But
thank you.
um, so why do we do this?
We all know why we do this because community is our beauty.
That's right. So
Yeah.
like, share,
So
and follow us on all platforms: Facebook, Instagram, YouTube, and spread the word.
Yes. Share, you guys. Until next time.